Good evening, everyone. On the behalf of Team Dentist Channel Online, I would like to extend a very warm welcome to all of you. I'm Dr. Aditi Mishra, and I'll be the host for today's session on the topic Ergonomics in Dentistry by Dr. Haritma Nigam. So, before starting with the session, I have few housekeeping notes to make. If you have any doubts during the session, you can put your questions in the question and answer box in your control panel, and we'll be taking up each and every question at the end of the session. If you have joined us from Facebook and YouTube Live, you can ask us questions by commenting and we'll be answering them at the end of the session. So without further ado, I would like to introduce our today's speaker to everyone. Dr. Haritma is the oral physician and maxillofacial radiologist and is an ambitious qualified dentist with excellent organizational and interpersonal skills, working as an assistant professor in the Department of Oral Medicine and Radiology, Pacific Dental College, Udaipur, Rajasthan. She has completed her undergraduation from Seema Dental College and Hospital Rishikesh and masters from Rajiv Gandhi Dental College and Hospital Bangalore. She has received best scientific paper presentations in numerous conferences. She has received Curofy's 2020 Icon of the Year, Excellence in Oral Diagnosis and Radiology 2021 awards. She has keen interest towards publication and has published numerous papers in various national and international journals. She is an author of book entitled Oral Manifestations and Dental Considerations of HIV. Contributor in textbook of oral medicine and radiology by Dr. Piyush Shivhare, yet working on another articles and books. She has attended various conferences and CD programs and has done various certified courses, including recently on COVID-19 conducted by AACC, WHO, and Harvard. She has been invited as the keynote speaker in webinar during the toughest time of pandemic by the pharmaceutical company on the topic dental hygiene in COVID-19 as well. She is a dental blogger named as Oro Mirror at WordPress, which is a platform in dentistry for understudies, experts, and overall population, an editor and reviewer of a reputed journal, ACTA Scientific International Journal, and official reviewer of elsewhere. She has done 54 publications, 15 original researches, 13 reviews, 21 case reports, and 5 undergoing letter to the editors. Over to you, ma'am. I think this, due to some technical glitches, the speaker isn't able to connect. Just give us few moments till we have our speaker back. So till then, I request all the participants to kindly make a note that if you have subscribed to our Prime membership, only then you can avail the all the benefits of the Prime membership. Like you will be getting e-certificate after completion of this webinar as well. So I'll be providing you the link for Prime membership in your chat box. So kindly stay tuned with us. And okay, till then, I'll just introduce our participants to the organization. Dentist Channel Online is our company, and it is the India's first digital dental marketing media company, which is striving very hard to bring all the dental practitioners, dental students, and basically everyone who is from dental fraternity under one roof and creating opportunity for everyone. We have come up with a new website. Kindly make a note of it, DentistChannel.Online. You can log in and avail a lot of benefits out of it. We conduct a lot of webinars and workshops every month. So, okay, we have our speaker back with us. Ma'am, can you hear me? Ma'am, can you hear me?
Now I can hear you. There was some network issue.
Okay, perfect. Good evening, ma'am. Welcome to Dentist Channel Online's webinar.
Thank you, Dr. Aditi.
Now, stage is all yours, ma'am.
Am I audible now?
Yes, absolutely, ma'am. Please go ahead.
Yeah, before proceeding towards my presentation. A very good evening to all of you. I would like to say thanks to the entire team of Dentist Channel Online and my sweet moderator, Dr. Aditi, for giving me this golden opportunity in this wonderful platform. The title of my presentation is Ergonomics in Dentistry. I would like to start my presentation with one question. Why is ergonomics an issue in dentistry? Means, what is the main purpose of introducing ergonomics in dentistry? Every occupation has its associated risk occupational hazards, which ultimately bring ergonomics into picture. A dentist is known to be more susceptible to postural problems due to limited access and restricted view, which makes more vulnerable to occupational risks. Therefore, proper ergonomic design should be given the utmost importance to prevent tedious strain injuries, which eventually can lead to long-term disabilities. There are main three key factors which is required for working efficiently and effectively. These three factors are optimum access, comfort, and control. If not, then it may lead to your musculoskeletal disorders, which is nothing but globally it is considered to be the second most commonest cause of long-term disability. It can induce premature fatigue, pain, and negative attitude towards the work. According to OSHA, that is Occupational Safety and Health Administration, it is nothing but a mismatch between two main factors. First one, that is your physical capacity of human body, and secondly, your physical requirement of job. As a result of which, it will lead to musculoskeletal disorders. So let us see what are musculoskeletal disorders. It is seen that dental work poses some interesting ergonomic challenges. While performing normal professional work, the dental surgeons have to repeatedly change their positions, either from your sitting position or standing position, or sometimes in one position for a prolonged period of time. They bend forward or to the sidewards while working on patients. While working or doing treatment, their patients, they're more concerned about their patients' comfort and they overlook their own health till they begin to experience discomfort or pain in their body. It is nothing but a major problem creator. So, this is musculoskeletal disorders are nothing but a wide range of inflammatory and degenerative disorders of muscle, tendons, and nerve. It may lead to pain and functional impairment. And the most common sites which are involved in our dentists are neck, upper back, lower back, shoulders, elbows, wrist, and your hands. Now, here is one question. How pain develops in an operatory? Let us see the pathophysiology behind this. There are certain risk factors such as your prolonged static posture, non-neutral posture, emotional stress, visual changes, or repetitive movements. As a result of which, it will lead to some physiological changes, such as your muscle ischemia, which means there will be decrease in blood flow to that particular tissue. As a result of which, what will happen? There will be some trigger points which will get pain and inflammation will start, leading to muscle imbalances. As your isotonic contraction, which is seen in a dynamic position, and your isometric contraction, which is seen in case of your static positions, in which your muscle lengthening will be same in case of your isometric contraction, whereas in case of your isotonic contractions, there will be rhythmic lengthening and shortening of your muscles. As a result of which, there will be upregulation of sympathetic nervous system, leading to your disc degeneration. Total outcome of it, which it will be your pain symptoms, such as your myofascial pain syndrome, musculoskeletal disorders, your disc herniation, and your nerve impingement. This is nothing but your prevalence graph, which has been plotted against while doing a survey in US, in which it has been seen that maximum number of musculoskeletal disorders are due to your wrist and hands, which is about 69.50%, then your neck, that is your 68.50%, then your upper back, which is 67.50%, and then your shoulders, it is 60%, then your lower back, which is your 56.80%. These are certain risk factors, such as repetitive motions, awkward postures, static postures, forceful exertions, duration, contact stresses, and vibration, which are seen during your dental procedures. In repetitive motions, such as while doing your scaling or polishing, And your awkward postures, such as your handling of object with back bend or twisted, which we usually see if we want some instrument or something from the trolley. Instead of pulling the trolley towards ourselves, we ourselves will back our bend our back. Then after that, that is actually harmful for the clinician. Next is your static posture, in which static neck or back or shoulders, in which a dentist will be in a prolonged period of time in one static posture. Forceful exertions, instead of using our skill, we'll use our force by extraction of the tooth. Duration, grasping small instruments for a prolonged period of time. Contact stresses, in which repeated contact with hard or sharp objects is being used. And your vibration, prolonged use of your vibrating hand tools, which may lead to a very severe phenomena, that is Raynaud's phenomena. It is also known as your hand-arm vibration syndrome. What a bad posture can cause. These are various disorders, musculoskeletal disorders, which can be resulted into that severe diseases. First one, as your back disorder, which includes your upper back pain or your lower back pain, in which it occurs due to the extensor muscle contraction. Your spinal disc sciatica, in which sciatica pain will be seen due to herniation of disc in a clinician. Second commonest disorders are your hand and wrist disorders, which include your de Quervain disease, your tendinitis, your tenosynovitis, and your carpal tunnel syndrome, and your trigger fingers. And next one is your neck and shoulder disorders, which includes your myofascial pain disorders, your cervical spondylitis, your rotator cuff tendinitis, your cervical disc disease, your trapezius myalgia, hand-arm vibration syndrome, such as your Raynaud's disease.
Sorry to interrupt you, ma'am. Sorry to interrupt you. Your voice is it's fluctuating. Can you keep your mic in front of your mouth, please?
Yeah. Now am I audible?
Yes, absolutely. Thank you so much, ma'am.
Yeah. So now we'll see these diseases one by one in my further slides. These are various common signs and symptoms. Signs includes your decreased range of motion, loss of normal sensation, decreased grip strength, loss of normal movements, and loss of coordination. Your symptoms, which includes your excessive fatigue in shoulder and neck, your tingling and burning sensation in arm, your weak grip, cramping of hands, your numbness in fingers and hands, and clumsiness in the dropping of your objects. Now, these are various, I have put major, or we can say this common diseases. One by one, we can see. Disease name is your de Quervain disease. Its possible cause is your twisting and your gripping, as a result of which clinician may get pain at the base of the thumb. In this pictorial representation, we can see that synovium, it will get inflamed. Another one is your trigger finger. Its commonest cause is repeatedly using your index finger, as a result of which clinician may get your difficulty while moving fingers, snapping and jerking movements. And one time in severe condition, it may be seen that your finger, it may get stick. Next is your rotator cuff tendinitis, which is seen when all your muscles of shoulders have been involved. Which is its important cause is you're working with hands above head, and the symptoms can be seen are your pain and your stiffness. Next commonest is your tenosynovitis, in which repeated or forceful hand or wrist motions will be restricted, as a result of which clinician may get your pain or your swelling. Next commonest is your hand-arm vibration syndrome, that is nothing but your white finger or your Raynaud's phenomena, which may occur because of your exposure to vibrations, means using your vibratory tools. And the patient may get your numbness, tingling, ashen skin, and loss of feeling and control. In this, there are three main procedures which can be seen. First one is your ischemia, which may occur due to your vascular occlusion of your artery, as a result of which they will reduce blood supply. Next phase is your cyanosis, in which there will be dilation of your capillaries and venules, but that will be filled with your deoxygenated blood. And the third phase is your rebirth, in which deoxygenated blood, it will be replaced by your oxygenated blood, as a result of which we will get these three types of colors in our finger, that is your white, blue, and your pink. Next commonest is your carpal tunnel syndrome. Its commonest cause is your repetitive and forceful manual task without time-to-time recovery. Means if we work for a prolonged period of time, in this what happens means your medial nerve, it gets compressed at the wrist and resulting in your numbness and your pain. In this, we should consider that we should see that our thumb will be involved, your index finger, your middle finger, and half of your ring finger will be involved. And patient may get your tingling, your numbness, and your severe pain and loss of strength will be seen. Sensations in your thumb, index finger, or middle half of the ring finger, it will be lost. Next commonest is your back disability. The possible causes your inflexibilities around the hip and your pelvis, in which because of your weakness of the stabilizer of the lumbar spine. Its symptoms are clinician may get your lower back pain or shooting pain or numbness in your upper legs. So till now we were just speaking about your musculoskeletal disorders and its commonest disease, its signs and symptoms. But now, till now I spoke about the problem. Now here lies the solution, that is your ergonomics. Ergonomics is nothing but it has been introduced as a discipline after your Second World War. These are 5 common steps which are seen to prevent your work-related pain in dentistry. Step 1, which includes your dental ergonomics, and step 2, which includes your stress management, which should be managed by the minimal use, that is your yoga and all, you can manage like that. Step 3, that is your myofascial pain treatment. Step 4, that is your chair side stretching. Whenever you get free, you can do such exercises. And last one is your training. You can ask your trainer for it. As it is a commonest saying, that is your prevention is better than cure, which will reduce your time, your money, and reduce your pain. What is ergonomics? According to International Ergonomic Association, it is nothing but a scientific discipline that is concerned with the understanding of interactions among human and other elements of a system, and the profession that applies theory, principles, data, and methods to design to optimize human well-being and overall system performance. It has been derived from 2 Greek words. That is, one is your ergos, which means your work. Another one is your nomos, which means your natural law of system. Therefore, it deals with the modification of work as per the requirement rather than accommodating with the existing conditions. Now, what is the main purpose of introducing this ergonomics? What is the main goal of behind it? First, reducing the risk of musculoskeletal disorder, which is damn important. Second one is improving working safety, increasing worker comfort, minimizing your worker fatigue, and improving your quality of work. Means your positive attitude towards your profession. These are certain applications of ergonomics in dentistry. First one, which includes your instruments, which is important, hand instruments and your vibrating pieces. Second, broadly classification is your equipment, that is your lighting and magnification, and operator and patient chair. Third is your work postures, which includes your patient position, dentist position, and your assistant position. These instruments which have been used in our clinics, it should have certain properties. It should be of lightweight, it should have certain parts, and it should be easy activation. Apart from that, it should be easier to maintain. It is seen that in a survey, it is seen that your minimum, your weight, it should be of 15 grams. Otherwise, what will happen if it is of more than 15 kg? Then what will happen? You may get your muscle get fatigued and there will be loss of interest in your work. You yourself get tired fast. And the magnification, it should maintain a great working distance. In this pictorial representation, we can see that clinician has been used. First one is your naked eye. Second one, clinician is using your loop. And third one, clinician is using your microscope. No doubt your level is same, but the thing is, in your second and your third one, your next plane will be lesser, so that you can work for a more long period of time. Second, your operating stool and your patient chair should be comfortable and good accessibility. These are working positions, which includes your operator position, your patient position, and your dental assistant position. In your working position, in your operating position, first one, your head, it should be slightly forward, means just a degree of 15 to 20. Second one is your torso, that is nothing but trunk of that clinician, in which longitudinal axis of torso, it should be upright. And apart from that, if it is required, then you can adjust your chair so that clinician can get your lumbar support. Third one is your upper arms, your elbows, and your shoulders. Your arms should be relaxed in one side. Your elbows should, in this forearm should be in front of your body, and your shoulders, it should be oriented towards your hips. And next one is your wrist. It should be keep in your neutral position. Probably it should be straight. That will be more comfortable for a clinician to work. Next is your, it should be held at a point comfortable and should be clear view for the should be there. Then feet, it should be flat, and lower legs, it should be in a vertical position such that it should be comfortable. And apart from that, for minimal body movement. Last one is your rear start positioning, in which it should be such that your knee should be at an angle of your 90 to 100 degrees. Means it should be exactly parallel to the floor, and your lumbar spine should be exactly perpendicular to the floor. Now, the patient position, which is also important. First, dentist position, it should be maintained, and after that, taking its reference point, you can allow the clinician to achieve optimal performance without any physical work. These are certain exceptional cases in which you need to do your procedures in an upright position, which includes your certain procedures. Apart from that, your elderly treating patients, apart from that, your medically compromised patients, such as patients which are suffering from your hypertension and your vertigo. And of course, your pregnancy, in which otherwise patient may experience your postural hypertension, and which can lead to your pain. Now coming to the dental assistant position, which is another important part of this ergonomics. It should be, dentist should sat in such a position that its level should be 15 to 20 centimeter above your clinician eye. It should be more in a comfortable position, and legs exhausting stability should be there and should be more accurate, and efficient treatment can be done like that. There are some recent advances. First one is a 400 dentistry, which is usually practiced nowadays, in which can differ in your right-handed people and your left-handed people. It has been categorized into 4 main zones. That is your static zone, assistant zone, your transfer zone, and your right-handed operator zone. That is your clinician zone. In a right-handed person, in a right-handed clinician, it should be between your 7 o'clock to 12 o'clock position. Whereas on your left-handed clinician, it should be between your 12 to 15 o'clock position. But if 400 dentistry is not being performed, then you are a only clinician working in that working area, then your zone should be divided into 3. That is, things which are used occasionally, things which are used frequently, and things no longer needed. Which are used occasionally should be kept on the dentist side, and which are used frequently should be kept on assistant side in an order and your time. And apart from that, things which are no longer used, which should be kept in a little far place. There should be alteration between standing and sitting position. No doubt, if you are performing your standing position, that is more comfortable because that will cause less strain to your back. But sometimes always we cannot stand also. So there should be alteration between standing and sitting position so that you can be more comfortable and you can for prolonged period of time you can work. Next comes your foot control dental. In this, 2 things we should keep it in our mind, that your shoes should be comfortable and your body outfit also should be comfortable. Apart from that, one is there, you should keep your feet half on your ground. Otherwise, what will happen if you have kept completely your feet on your pedal, then what will happen? There will be disbalance between your left feet and your right, whichever you are using. As a result of which, you will get back pain and your leg pain. You should always use your matte surface instruments. Otherwise, what will happen? it will show your glittering effect. As such, no survey is being used that in which your particular time or particular standardized time has been introduced, but it should be maintained at a temperature of greater than 25 degrees Celsius. Yes, ambidextrity means no doubt some people are right-handed and some people are left-handed, but try and we work whatever which are we are dominantly. But the thing is, if you're changing your positions, then what will happen? You will get less fatigue. Next, of course, you should track micro breaks. It may be lesser than 30 seconds or to 1 minute, then so that your shoulders, your hands, your wrist, it should get a break and you can relax for a while and you can work for a prolonged period of time. Next is your scheduling time. It should be flexible. You should always schedule, means you should, how to do it is like you should keep an alteration between your easy cases and your difficult cases. So that muscles you can get lesser fatigue. Of course, yes, your gloves should be of proper size, and otherwise, what will happen if suppose your gloves are of larger size, then what will happen? Instead of keeping your maintaining your grip, then what you will do, you will just grip it, which is not good for working. Otherwise, and if it is smaller than your whatever is your prominent size, then what will happen? There will be neurovascular compressions which we see. Then how to know that it is of your proper size? Then what you can do is you can measure the circumference of your dominant hand just below your knuckles, and then you can compare it to your XS, your S, your medium size, and your large or XL or your double XL. Even though it depends on your manufacturer to manufacturer, it varies. These are certain exercises which you can perform when you are free. That is your shoulder blade exercise, in which you can move your shoulder to the back with your arms hand straight. Sorry. Then you can roll down. You can use your ear to shoulder. You can just press the palm of your hand to the opposite side, and you can bend your neck. This is a good exercise for your neck strain as well. Spinal twist, in which you should sit straight or stand straight. Apart from that, you can adjust your dental chair so that your lumbar spine is in a straight position. And then you can twist in right side or left side as your necessary. Apart from that, you can open and you can close your fingers and your wrist. Your back lift you can perform, your back stretch you can perform, then your thumb stretch you can perform, and your wrist flexor. All these exercises you can perform about around 10 to 15 times in a day. This is a good exercise for your fingers and for your wrist. In this, you can take one elastic ball or band, in which you can use first figure, you can see you can keep that elastic ball in between your fingers. You can finger scissor, like how you just hold your scissor and you just open and close like that. Your fingertip pinch, in which with the help of your palm of your fingers, you can just press to that elastic ball. Or your power grip or your flat pinch, you can use your finger spread. As you can see in those figures, you can do your finger extensions with the help of these elastic bands and your full grip. And of course, at the end, I would like to say this is most important one. That is personal protective equipment, which we have seen during our COVID time. It is very tedious to wear all these things if it is not put properly in front of your patients. Then, as a result of which, what you can do, you can schedule one thing, your test appointment with your clinic. You can try beforehand so that you should not feel difficulty in front of your patients. Yes, last but not the least, in a nutshell, I would like to say, take care of your body. It's the only place you have to live. It is the paramount important for every dental practitioner to work in a right posture and shape in order to maintain a good form, function, and health. These are my references. You can follow me as a dental blogger. For your feedbacks and queries, you can mail me. And this is my mail ID. Thank you.
Thank you so much, ma'am, for such an amazing session. And I'm sure that each and every participant would have made their back straight the moment you had come with that slide. So everyone would be sitting with that bow, a bow-shaped back. And the moment I saw that slide, I was like, okay, fine, let me just correct my posture first, and after that,
Actually,
proceed.
actually,
All
it
right.
subconsciously
So
it happens. Yeah.
yes. So actually, it is very much important because after like truck drivers, it is the dental professionals which have this backache problem a lot. So yes, even I'm facing the same thing, so I won't deny it at all. So anyway, so moving on to the question and answer session, I request all the participants, if you have any doubt, you can put your questions in the question and answer box so that we can take up your questions. And before moving on to the question and answer session, I have a presentation, small presentation regarding our organization, and I'll be introducing you all to our organization. Okay. So as I said, we are Dentist Channel Online, healthy smiles that leads to wealthy lives, and we are the India's first digital dental marketing media company, which is striving very hard to bring all the dental professionals under one roof and creating opportunity for everyone. We have come up with a brand new website, DentistChannel.Online. Kindly make a note of it and log into our website to catch all the details, all the latest news and upcoming webinars and events that we are having. We conduct a lot of webinars and workshops every month. And if you subscribe to our Prime membership, you can avail a lot of benefits out of it. Like if you have our Prime membership, you'll be receiving an e-certificate for the webinar which you have attended just now. So the Prime membership will cost you just, the annual Prime membership will just cost you 499 rupees. And this is one sample e-certificate which you'll be receiving at the end of the session. And this is only for the Prime members. Okay, I request all the participants to kindly save this number, make a note of it, and you can send your full, you have to send your full name on this number, and we'll be adding you in our broadcast list so that you are updated regarding each and every upcoming session that we have. So this is our sponsor, Novamind.GmbH, generic implants and prosthetic solutions, which come up with very innovative dental and healthcare solutions to ensure your success. For the recorded videos, if somehow you have missed out on our live session, you can go back to Facebook and YouTube on our channel at the rate Dentist Channel Online, and you can watch the recorded videos there. And you can follow us on Instagram, and we have come up on Telegram as well. We have a channel on Telegram. So using the same handle, Dentist Channel Online, you can follow us there as well. Okay. So okay, you cannot get the PPT, Dr. Vidya, but surely you can watch and learn a lot from the recorded videos. So before ending the session, ma'am, any takeaway note for our participants? Hello, ma'am, I was asking any takeaway note for our participants before ending the session?
Yeah, you should always maintain your posture because see, we being a dentist, we need to work for a long period of time. As I said in my starting slides, that we work professionally. We just overlook our we thinking at that should be comfortable at that time, and we'll just think about them instead of looking our health. Until unless we get that severe backache or hand or wrist ache or all those things. So always just start performing such exercises whenever you are free, whenever you get short breaks. And apart from that, you can just go through these slides and my mail ID is there. You can just sum up with all those queries.
Yes, absolutely. And Whosoever wants to reach out to Dr. Haritma can contact us, can contact me, and I'll help you out to reach out to ma'am. Thank you so much, ma'am, for being with us, and we're looking forward for more sessions with you. And
Thank you, Doctor.
thank you so much for coming.
Thank you, Doctor.
So with this, thank you so much to all the participants who have attended. So with this, we are ending today's session. Thank you and have a great evening ahead.